Hello friends, this is Shubham and today I'm going to talk about acute pancreatitis. Throughout this video, I will discuss about what is acute pancreatitis, what is the definition, the pathophysiology behind the acute pancreatitis, the etiology, what are the major causes which can occur acute pancreatitis, about the signs and symptoms, what will be the clinical manifestations, about the lab investigations, lab data, physical examination of the patient through which we can make the correct diagnosis for such patients of acute pancreatitis, about the management, how could we treat such patients, and at last about the complications, that what could be the complications if the acute pancreatitis left untreated. So let's start with the definition. Actually, acute pancreatitis, as you can understand from the term pancreatitis, it is the inflammation of the pancreas by the autodigestion of its own enzymes. Now, if we talk about the pathophysiology, there are two major causes which causes the acute pancreatitis. Actually, the gallstones and the alcohol are the main causes behind the acute pancreatitis. Those patients who have the habit of drinking alcohol, they are much more closer to having the disease acute pancreatitis. And also the gallstones, those patients who had the gallstones in their past, so they could also have the acute pancreatitis. Because the gallstone can come from the gallbladder, the gallstone can come from the common bile duct and can obstruct the pancreatic duct, which can cause the inflammation of the pancreas and can cause acute pancreatitis. Now, if we talk about the anatomy of the pancreas, pancreas is situated in the retroperitoneal position, that means the behind the peritoneum. Actually, it is situated, as I have drawn over here, this is the liver and this is the hepatic duct, actually left and right hepatic duct coming from the liver, and which will make the common hepatic duct. Now, common hepatic duct will continue into the gallbladder, and there is here is the cystic duct which continues into the gallbladder, and cystic duct and common hepatic duct will make the common bile duct. Okay, and common bile duct will continue down and will join the pancreatic duct, which is coming from the pancreas. So pancreatic duct and common bile duct will together join into the duodenum and through the sphincter of Oddi. Now, actually, pancreas is situated just behind the stomach. This is the pancreas I have made over here, and this is the stomach. It is just behind the stomach. That's why I have drawn it here with the dotted lines. That means behind the stomach. So, actually, pancreas have two functions. They have exocrine functions and they have the endocrine functions as well. So, this is the mixed gland. Now, exocrine function, how it is performing its function, that pancreas is secreting its enzymes into the pancreatic duct for the proper digestion of our food in the small intestine, or you can say in our gut. So, what are these enzymes? These enzymes are amylase, lipase, and proteases. These are the enzymes which are secreted from the acinar cells present in the pancreas. Actually, the acinar cells are present over here. Acinar cells are present over here, and they secreted the enzymes into the pancreatic duct. And these enzymes are secreted through the pancreatic duct into the duodenum through the sphincter of Oddi and will help in food digestion by our gut. Also, the pancreas is secreting the bicarbonate into the duodenum. Why? Because our gut, our small intestine needs the alkaline medium to digest our food. Because the stomach is dumping the acidic content into the duodenum, that is small intestine, the first part of the small intestine. So they are dumping the acidic contents into our duodenum. So there should be the alkaline medium in the small intestine to proper digest the food. So that's why the pancreas secreting the bicarbonate ions into the duodenum, which would be helpful for the proper digestion of our food. So they are secreting the enzymes, they are secreting the bicarbonate ions. However, if there will be the acute pancreatitis, they would not be able to secrete the enzymes, or if they will be able to secrete the enzymes, they will be inflamed. Or for example, here is the gallstone which is causing the acute pancreatitis. So if there will be the enzymes that are coming from the pancreatic duct and they are urged to go into the duodenum, so there is the obstruction over there, so there will be the backflow of the enzymes, and that can cause the autodigestion of the pancreas. So actually that happens into the pancreas, that if it is inflamed, it is due to the autodigestion of its own enzymes. So this was about the gallstones. Ethanol, that is alcohol, also causes the autodigestion of its enzymes, so which can also cause the acute pancreatitis. Now I was talking about the exocrine functions, that they secrete their enzymes, that is amylase, lipase or proteases, into the pancreatic duct, and which will be helpful for the digestion of our food in the small intestine. Now how they are performing their endocrine functions? Actually they are secreting the hormones into the blood. Which hormones they are secreting into the blood? For example, alpha cells secretes alpha cells of pancreas. Alpha cells of pancreas, they are secreting the glucagon into our blood. Glucagon. Beta cells of islets of Langerhans in the pancreas. What they are secreting? They are secreting the insulin into our blood. And there are the delta cells also. Delta cells. They are secreting the somatostatin. They are secreting the somatostatin. So these are the endocrine functions of the pancreas. So alpha cells are secreting glucagon, beta are secreting the insulin, and the delta cells are secreting the somatostatin. So this is the function of that's how they are secreting their hormones into the blood, and they are controlling the level of glucose actually in the blood. Now this was about the pathophysiology. Now let's talk about the etiology. What are the causes of acute pancreatitis? So I'm going to rub it over here. Let's rub this. What would be the etiology of acute pancreatitis? So let's talk about the etiology. Actually, there is a famous mnemonic for remembering the etiological factors of acute pancreatitis. That is, I get smashed. So I get smashed. Now what is I? I is idiopathic, means we don't know the cause, that what is the cause that is having the acute pancreatitis. That is idiopathic, unknown cause. However, there are very few patients to which we don't know the causes, actual causes which are causing the acute pancreatitis. Idiopathic. G means it's gallstones. that gallstones, and in most of the patients, gallstones and E for ethanol, they are the major causes, as I've already mentioned, that they are the major causes for acute pancreatitis. So E, it's ethanol. T is for trauma. Any trauma or any physical or mechanical injury in the central part of the stomach, in the central part of our body, they can cause the acute pancreatitis because it can cause the harm to the pancreas. S, some steroids, anabolic steroids can also cause the acute pancreatitis. M is for the mumps virus. Mumps virus, they can also cause the acute pancreatitis. A is for autoimmune disorders. Various kinds of autoimmune disorders can also cause the acute pancreatitis. Now, S, some scorpion stings can also cause the acute pancreatitis. The scorpions can also cause the acute pancreatitis. H, hypercalcemia or hyperlipidemia. Hypercalcemia or hyperlipidemia. They can also cause the acute pancreatitis. Now E, it's ERCP, which means the endoscopic retrograde cholangiopancreatography. So ERCP. If the patients are having ERCP, very often it can also cause the acute pancreatitis. Endoscopic retrograde cholangiopancreatography. D, of course, various kinds of drugs like diuretics, furosemide, and some seizure medications, valproic acid for example, some antiprotozoal drugs, for example metronidazole, they can also cause the acute pancreatitis. However, these two are the major etiological factors. These two are the major causes for the acute pancreatitis, and these are the minor ones. However, they can also cause acute pancreatitis, but in most of the patients, it has seen that gallstones and ethanol are the major causes for such patients. Now, this was about the etiological factors. Let's talk about the clinical manifestations, that what are the signs and symptoms for such kind of patients. So let's talk about the signs and symptoms. Actually, these patients also, they don't want to eat, and they should not eat anything, because as they will eat, what will happen into the body? As they will eat anything, we should digest the food. So for the proper digestion of the food, we need some enzymes which are secreted from the pancreas. So as the pancreas is already inflamed in such patients, so pancreas, if in that case pancreas will secrete enzymes into the pancreatic duct, it will be more painful for such patients. They can cause the vomiting. So in such patients, let's talk about signs and symptoms. Signs and symptoms. Nausea and vomiting. These are the main signs: nausea, vomiting, fever, high temperature. Also the sign, they can cause jaundice due to the backflow, and also there is the general sudden pain, central epigastric pain. Remember in appendicitis, I've told you that there will be the pain in the right lower quadrant. In the cholecystitis, I told you about the pain would be in the right upper quadrant. And in the acute pancreatitis, the pain will be in the central epigastric pain, because the pancreas is situated just behind the stomach in the retroperitoneal position. So the pain will be elicit in the central epigastric position. So there will be the general sudden pain, general sudden central epigastric pain, central epigastric pain. Now, in such patients, you will notice that they will be in the tripod position. What is tripod position? That they will lie towards the forward direction with holding their stomach, which means in the severe cases, this tripod position actually relieves the pain in such kind of patients. So there will be like this. It means the tripod position will relieve the such pain. So which can be sign for the acute pancreatitis. So tripod position. It actually the relieves pain. Relieves pain. Now, also there will be the high heart rate for such patients. Tachycardia. They would have the tachycardia. Now, I have told you about the pain. It will be in the sudden central epigastric pain. So this pain, in 50% of patients, this pain can radiate to the back. Can radiate to the back over here. So there will be the radiating pain towards the back. Towards back. In 50% of patients, which I've seen, that the central epigastric pain radiates to the back. In appendicitis and cholecystitis also, the pain radiates to the back, in the back direction. However, in appendicitis, the pain is in right lower quadrant, and in the acute cholecystitis, the pain is in the right upper quadrant. In acute pancreatitis, which is today's topic, we are talking about the pain in the central epigastric position. So this was about the signs and symptoms of acute pancreatitis. Now let's talk about some lab data. That what we can test in the patient to confirm about the acute pancreatitis. So let's talk about investigations, lab investigations. Lab investigations. Now, you can go with the serum amylase or serum lipase tests. So you should check about the amylase and lipase level into the blood. So first of all, serum amylase or lipase. Now, amylase can be higher in the blood, but it is not so significant for the acute pancreatitis, because amylase is also present in our starch in the saliva of our mouth. So amylase can come from there also, and there will be the hyperamylasemia, which means higher amount of amylase in the blood. Also through the GIT perforations, amylase can come into our blood. So that is the not so significant for the acute pancreatitis. However, lipase, if lipase is in higher concentration in the blood, that could be the most significant one for the acute pancreatitis. Because while the pancreas is inflamed, it can secrete more and more lipase into the blood, which is more significant as compared to the amylase in the acute pancreatitis. However, amylase is also the sign, higher amylase concentration is also the sign for acute pancreatitis, but not most significant one. Most significant one is the lipase, higher amount of lipase in the blood. So this was our serum amylase and lipase. We should also check for the blood arterial gas. Blood arterial gas. That what are the amount of the gases which are flowing in the blood. Also the calcium level in the blood. Calcium level in the blood. And if there is higher concentration of calcium in the blood, this can indicate about the acute pancreatitis. So this was about the lab data, what we can check in such patients and confirm about the acute pancreatitis. Let's talk about the physical examinations. Which can confirm you about the acute pancreatitis. Actually, there are two famous signs. Physical examination. About the physical examination, there are two more famous signs, that is Gray Turner sign and the Collins sign. Gray Turner sign and Collins sign. These are the most specific one for the acute pancreatitis. We have seen such kinds of signs in the patient body. Now, I'm drawing here the body of such patients. Okay. So this is about here is the belly button. Okay. This is about the belly button. And if the patient is feeling, if the patient is having the red ecchymosis near the periumbilical region, it means they have the ecchymosis, red signs, red bluish signs in the periumbilical region or in the sides, in the lateral sides. That means they have the Gray Turner sign. They are the positive for the Gray Turner sign, and that is the more typical for the acute pancreatitis. They are more typical for the acute pancreatitis. Now, in the Collins signs, what they will see, if there will be the pain, there will be the ecchymosis in the periumbilical region. Actually, if they have the reddish colors ecchymosis in the lateral side or in the back in some cases, or in the groin areas also, they have the Gray Turner sign. But if they are having the ecchymosis in the periumbilical region, that is the Collins sign. So this is the Gray Turner sign. Gray Turner sign. And this one is the Collins sign. So these are the two particular tests for the acute pancreatitis. Now let's talk about the treatment of such patients, or management you can say. Actually, they should not eat anything through the mouth. They should be kept nil porous NPO. And for maintaining the proper electrolyte balance in our blood, in our body, they should be given intravenous fluids, IVF or cannulation. Now, as these patients have nausea, vomiting, they should be given the antiemetic drugs, antiemetics. Also, as the pancreas is inflamed in such cases, so there could be the bacteria over there. So you should give them antibiotic dose, antibiotics. You should hourly check the heart rate, urinary output, pulse rate for such patients. Hourly check about the heart rate, urinary output, and blood pressure in such patients. Now, also, urinary catheter is important for checking the urinary output for such patients. Urinary catheter. And the nasogastric tube can be helpful for feeding such patients. Nasogastric tube. So this was about the management of acute pancreatitis. Now let's move on to the complications. What complications could have such patients? Let's talk about the complications. Actually, acute pancreatitis, if it left untreated, so it can be converted into the chronic pancreatitis. So the first complication is the chronic pancreatitis. So acute pancreatitis must be treated in time, otherwise it can cause various kinds of complications. Chronic pancreatitis, as well as if pancreatitis left untreated, it can cause the fistulas. It can cause the acute lung injury. Because the pancreas can rupture and its content can goes into the lungs too. Further, they can cause the acute renal failure also. Acute renal failure. They can also cause the pancreatonecrosis. Also, they can cause the pancreatic effusion. So these are some complications of the acute pancreatitis. That's why it must be treated in time. Otherwise, it can cause various kinds of complications, which obviously are not good for the patients. So this was about the acute pancreatitis. I hope you like this video. Thanks for watching.